Welcome, everyone. An extended welcome to the members from the community. Just want to mention that TAIBU CHC organized this town hall meeting. Out of our respect for Indigenous peoples in Canada, we would like to acknowledge that TAIBU CHC is situated upon traditional territory. We also recognize the enduring presence of Aboriginal peoples on this land. A little background about TAIBU CHC. Well, let me tell you about myself first. My name is Cheryl Wedderburn. Some of you may know me as Cheryl Bernard. And I am your moderator for this evening. My background is in healthcare. I am a registered nurse I have worked in senior leadership for the last 25 years across various sectors. I am also the owner of a consultancy firm, healthcare consultancy firm, Bernard Consultancy, and also the founding president for a charity, the Jamaican Canadian Association of Nurses. And we've done a lot of great work with TAIBU Community Health Center. So I look forward to engaging with you this evening for this town hall. TAIBU is a multidisciplinary, not-for-profit, community-led organization established to serve the Black community across the GTA as a priority population. They're located in the Malvern community, and TAIBU provides primary health care and related services. Recognized that systemic oppression has fostered conditions of ill health in Black communities, TAIBU strives to deliver these services through intersectional, equity-based, and culturally affirming practices, which promote holistic wellness, health education, and prevention. Some of the additional services that TAIBU offers includes interprofessional healthcare from physicians, nurse practitioners, and registered nurses. Some of their programs offered includes just to name a few, diabetes education. They offer foot care, nutritional counseling, and specialized care. They're well known for the work that they do with the sickle cell population. And that's really just to name a few. But this evening, the purpose of this town hall is to provide information about how COVID-19 has impacted the Black community, and to answer some of the questions that you all have about COVID-19 vaccines, the testing, and COVID-19 supports that are available to the community. So we're most definitely going to look to our experts to provide us with some clarity, some real talk, some statistics on this information. But we have some housekeeping that we want to share with you. The town hall is being live streamed. Hello, everyone, on Facebook and YouTube. So please see the links on the screen to share with your friends and family. So if a friend or a family member would like to dial in to listen to the town hall by phone, they can also reach us. If you see the details somewhere here on the screen, they can call into that number, enter the passcode, and just follow the instructions, and they should be fine to connect with us by phone. Questions from the audience will be taken from the comment section below via YouTube or Facebook live video. We have giveaways this evening, y'all. Giveaways. So we will be having a raffle. There are 3 $200 vouchers to be won. In order to enter into the draw to win one of these vouchers, you must share this event with 5 family members or friends. 5. So you must share it on social media, Facebook, Instagram, or Twitter, and tag using TAIBU's handle. Okay, so you can see those on the screen as well. So please share. And did you hear what I said? 3 prizes of $200 vouchers. I guess I can't win. Oh, well. Or none of the panel members either. Just take note, none of the panel members can qualify. So it gives me great pleasure to co-introduce, and I say co-introduce because the panelists are going to be introducing themselves, but it gives me great pleasure to introduce our panelists for this evening. Let me just identify each of you by name first, and then I'll give you the opportunity to speak a little bit about yourself. So tonight, we have three special guest speakers from impressive backgrounds, and they will share with you a little bit about themselves. Tonight's town hall will include discussions from each guest speaker about specific topics. Questions for each panelist have been gathered from the community yourselves, for those of the committee members who are on, and questions from comments will also be asked. So if you can just wave when I mention your name, and then you will self-introduce in the same order. Dr. Nnorom, Nicole Welch, and MPP Mitzie Hunter. Hi, Mitzie.
Hello.
All right, so I'm going to ask each one of you to introduce yourself, tell us a little bit about yourself, and then answer the question, how you've been, tell us about yourself and how you have been able to make an impact throughout COVID. Okay, so that will be included in your self-introduction. So let us start with Dr. Nnorom. You have 5 minutes. We can't drag you off the stage, but we can silence you. So just keep an eye on the time, and I'll kind of do my best to wave you down if you've gone over a little bit over time, okay?
Okay, yeah, no problem. I'll try my best. You know how doctors like to interrupt everybody, so it's karma to just interrupt me, shut it down if I go over time. So yes, my name is Dr. Onye Nnorom. I am a family doctor, and I'm also a public health specialist. So similar training as medical officers of health that run public health organizations. But my work has largely been focused on Black population health and anti-racism. Because that impacts our health, particularly as Black people. So in fact, I worked at TAIBU for several years, from 2013 to 2018, and I'm still involved in research at TAIBU Community Health Center. But a lot of, like I said, a lot of my work involves anti-racism work, because I grew up in Canada, originally from Montreal. I'm half Nigerian, half Trinidadian, and a lot of my parents' work was in community. And so at a very young age, I became interested in anti-racism work and activism. So my clinical work or my medical work focuses on teaching. So I teach at the University of Toronto as the Black Health Theme Lead. I teach medical students and also physicians on how racism, and also specifically anti-Black racism, has an impact on our health, from whether it's hypertension or stress or mental health, how anti-Black racism creates disparities and things that we can do to dismantle anti-Black racism inside and outside of healthcare. I'm the Equity, Diversity, and Inclusion Lead for the Family Medicine Department at the University of Toronto. And I'm also the Associate Program Director for the Residency Program in Public Health that, again, trains people who end up being medical officers of health. Clinically, I work at CAMH, so the Center for Addiction and Mental Health. So that's where I came to work after my time at TAIBU Community Health Center. And then in addition to that, I also am the president of the Black Physicians Association of Ontario. So a lot of our work focuses on addressing increasing our numbers in medicine. So we've been very successful working with the University of Toronto and several medical schools to go from like 1 Black medical student at U of T about 4 or 5 years ago to this year we've had 26 Black medical students in the class, and actually a historic number across the country. And I also am the host of a podcast called Race, Health, and Happiness, where, and you can find it on any platform, but it's really about how to stay well in a racialized world. So really my passion is around the issue of anti-racism work and training for that kind of change in healthcare. With the COVID-19 pandemic, particularly as a public health physician, I have tried my best to play a role in advocating around an understanding of anti-Black racism, advocating for the collection of race-based data, along with many community organizations, including TAIBU Community Health Center, and a lot of experts, Black community health and physician experts, but not only for that data to be collected, but for us to be at the table as to how it is interpreted and how it will be used for positive action that benefits us. And with the COVID-19 vaccine, doing this work, speaking out, and also giving, acknowledging that our community is wary of, these types of when a new vaccine or something comes up like that because of our history and present day realities of anti-Black racism. So working in healthcare and in government to really let them know that they have to do a better job at becoming trustworthy so that we can then trust them. So that's some of my work. Am I at 5 minutes? I tried.
You excellent, perfect. Thank you. I certainly hope, well, I'm exhausted actually listening to your bio, but I certainly hope that our leaders and government officials know where to reach you to get some of that race-based data to inform some of the decisions that are being made, because we most definitely need that for our community so that they're making informed decisions. So thank you very much. All right, Nicole, please tell us a little bit about yourself and answer the same question.
Great, thank you very much. Thanks for inviting me this evening. I'm glad to be here with everyone. So I am one of the directors at Toronto Public Health. I'm a registered nurse. I have a Master's of Science in Nursing, and I'm currently finishing my PhD at U of T, and I'm looking at parenting among racialized parents and their racial socialization practices. So if God willing, I will be able to finish that up sometime this year. But the pandemic came and my work at Toronto Public Health. Since March, I've been assigned to our COVID response. Currently, my role is as the director of our COVID-19 liaison response. So I am responsible for our school team. So we have a strong and mighty team of nurses that provide liaison support to about 1,200 schools here in Toronto. So that's publicly funded at independent schools. And we also do our case investigations and outbreak management in the school setting. So that is a large part of my portfolio and a very active file. In addition to that, I'm also responsible for our community outreach rapid response team that works in the community. And we've done a lot of great work over the years, even prior to our COVID response with TAIBU. And we're still working actively with them. One of the areas that I'm involved in is the Black Task Force for vaccine information and looking at hesitancy and how we can get that information out to our community. So that is really exciting work. In addition to the teams that I have at Toronto Public Health, we also have an enforcement team that does inspections in a variety of settings that are open to the public to ensure that COVID measures are in place and to help support businesses and churches and synagogues, et cetera, to implement the public health measures. So we do provide a lot of education as well as enforcement in that area. We also do a lot of the guidance documents that you'll see on our website, which we continually update for the public's information. So I do, recommend people look at our website. It's evidence-based information that we keep up to date with the latest and greatest as we learn more about COVID each and every day. Sometimes it feels like hourly we are learning new things. So the work that we do in Toronto Public Health has supported the communities in COVID. And one of the things, and Dr. O mentioned it, and it's collection of race-based data. So I was involved in the beginning of the collection of this data that we started in May to collect race-based data for those that are exposed to COVID. And this information was instrumental in moving other parts of government and other public health units, et cetera, to begin to collect this data. And we really worked closely with the community, members of the Black Health Leaders Group, Wesley Institute, and other key Black leaders in the community to get this information out to the public so we could have a full understanding of the impacts on our communities. And And as we know, we do see a greater impact of COVID in the Black community, as well as some other racialized communities in Toronto. And I'm sure we'll get an opportunity to talk more about that. So I do look forward to making that connection. And, this work, I had the opportunity, and I just want to mention it I believe it was last year. No, not 2020. It would have been 2019. Nope, sorry, it was 2020 when we did the Black Mental Health Day with TAIBU as part of the Toronto for All campaign. And I was part of that team that was helping to do that planning. It was such a great opportunity to connect with the community and build a program and a response that was community driven and community led, and to see the city support the work of the community to get that information out and really have a good understanding of the impact of mental health, particularly when we're dealing with racism in our communities, which does exist. And I will say, maybe even 5 years ago, to talk about anti-Black racism, in government, et cetera, was not really the cool thing to do, let's say. And now it is much more open. We do have at the City of Toronto a Confronting Anti-Black Racism unit, which is so very important to doing our work. And the reason I mentioned that mental health work and the campaign that we did last year for Black mental health, it is Black History Month. And it is something, as we're going through the pandemic, we really need to take care of ourselves and one another, because the impact that we're seeing of the pandemic. So there's the illness, there's seeing family members become sick, and unfortunately some that will pass away, but it's also the lockdowns and not being able to have our social connections and connecting with one another, not being in the same space. And, I get you.
You know what? I can see that you're getting very passionate about that piece, but I'm going to get you to hold that thought.
Okay, no problem.
Because I'm going to ask you questions that will enable you to elaborate on exactly what you're talking about now. So hold that thought. Thank you very much. But I also want to personally thank you for the guidance documents. I find those extremely helpful, especially in my work as a consultant in healthcare. There's a lot of information out there. Sometimes people are misinformed. Sometimes people just have too much information that they don't know where to go to. So thank you very much for those documents. They're very, very well written. So thank you. I appreciate that. And our third panelist, you would think at this point that MPP Mitzie Hetzer needs no introduction, but you know what, Mitzie? We will allow you to do that. So tell us a little bit about yourself and answer the same question about what you have been able to make an impact on throughout COVID-19. Just a brief intro.
Well, thank you, Cheryl, and thank you for your amazing advocacy and the work that you're doing at JCAN. I did notice that your virtual walk was incredibly successful, and I hope that you do more of those. Don't do it just annually. Maybe it's a quarterly walk, because heaven knows we need to get up and move. So anything that gets us doing that, we should be doing it. Hello, everyone. Happy Black History Month 2021. My statement this year was about Ubuntu, and it is the spirit of togetherness. I wear my purple shawl. I received it as a gift when I visited South Africa some years ago, about 5 years ago. And it reminds me of the place in which we are today as a Black community. You must remember that we are in the midst of the decade that the United Nations has declared for African people and the diaspora. And in the middle of this decade, what has landed is a virus that has threatened humanity. Who would have thought? I would never have thought this. A year ago this time, I was actually running to lead our party as, the head of our party, talking about bold change, talking about all the things that we want for the future. And, not at all thinking about, how do we save lives? How do we keep people safe? But just 3 days after I gave my speech at that convention, I went back to the Legislative Assembly of Ontario, where I am elected as the MPP for Scarborough-Guildwood. And I am there to be a voice on behalf of the people of my community. That is why I was elected. It's to be that strong voice. And I feel an obligation every time I am at the legislature to do just that. And so I asked a question of the government on March 11th, 2020. And I said, you know, we have to keep our seniors and our elderly in long-term care safe. And I urged the government to make decisive decisions to close the doors on long-term care, to protect those vulnerable seniors from what we thought at the time was a respiratory virus. We didn't realize all the ways in which COVID-19 would strike, but there was something in me that said, let us sound this alarm. And it's because I'm from Scarborough, and SARS, when it hit, was first diagnosed in Scarborough, and I understood the risk. And this many months later, we see the devastating toll on long-term care. I continued to sound the alarm on things that we need, from strengthening our supports for personal support workers. There is a lot of men and women from the Black community who are the frontline care workers, who are the essential care workers, who really are the ones who braved the brunt of this virus to make sure everyone had food on their tables, to make sure that the systems continued to run and that our healthcare system continued to be responsive. And so, that was my job as a reminder, was how do we make sure that we protect those essential workers who are putting everything on the line and giving everything. I also, very early in the pandemic, I started doing just virtual town halls every month. We continue to do that. Our local Scarborough-Guildwood MP, MPP, and City Councillor to provide information transparently. There is one tomorrow night. We have Dr. Isaac Bogosh, who will be answering direct questions, and everyone can join. It's open and free to join, because I believe that sharing facts and information is very important, and to get that out into my community. It is my responsibility as the local member to get that information out and to share that. And I think finally, it's getting the government to move and to recognize that there's a disproportionate effect of this virus on communities. It is not affecting everybody the same everywhere. It is not, when you look at the statistics from the TDSB, for instance, a majority of parents in my community chose to keep their children home. They didn't send them to school for in-person learning. And there's a reason for that, because they recognize that there's a heightened risk of community spread of this virus. And so I continue to advocate for more resources in Scarborough, places like Scarborough that have a high infection rate. The Scarborough Health Network tells me that our assessment centers, including the one that TAIBU runs, has almost a 20% infection rate in terms of positivity. That is alarming. It requires more. I know the Minister of Health, I spoke to her just last week about resources for Scarborough. And she says, Mitzie, I hear you. She was aware of the work that TAIBU was doing on behalf of the community, on behalf of the health of the community. And that's my job as your strong voice. It's to bring these things to the government's attention. And while I am elected, I will continue to do that. Thank you so much.
Thank you. And you will have the opportunity to share a little bit more about that also. But I want to say, Mitzie, that you most definitely have been a strong, consistent voice on behalf of our community. I can most definitely speak for JCAN, and I am comfortable to also speak for TAIBU, because I've stood beside you at TAIBU for many initiatives and many events. So I just want to acknowledge that.
Oh, by the way, I'm also a girl from Scarborough. I grew up, I went to Churchill, the high school, went to U of T Scarborough campus. So I am all Scarborough all the time.
We know, and you're also rocking that purple scarf, so Ubuntu all the way. Okay, let us jump right into our moderator questions. So what we will do is we will do one speaker at a time, and then we will give the community members an opportunity to have their questions asked on their behalf, which I will do, and then give the speaker the opportunity to respond. So Dr. Nnorom, you are up first. And your questions are related to COVID-19 vaccines and general information about the virus. So people are questioning the speed of the vaccine development. Has there been a proper clinical and ethical process followed? I guess essentially, are the COVID-19 vaccines safe?
Okay, so
It's an open-ended, close-ended question.
right. So yes, they are safe because they followed the protocols that we usually follow for a vaccine. Now, I know the wording that has been used sometimes is like rushed. No, it was I suppose an expedited process, but followed all of the pieces that you have with vaccine safety. So in Canada, we have our National Advisory Committee on Immunization. So that's similar to the United States and the CDC. So there were the phase 1 trials where it's a smaller group and you have like healthier subjects. Then phase 2 with and 3 where you have more of the general population. So in fact, these types of vaccines had the process for testing out coronavirus vaccine and also the testing of, because it's a different type that we have right now with Pfizer and Moderna, which is the mRNA vaccine. These things had actually started about 10 years ago. In particular, so Mitzie Hunter mentioned SARS. So at the time of SARS, there had been a development of looking at these types of SARS-CoV viruses, which the coronavirus or COVID-19 is. But once SARS went away, the funding went away, there wasn't as much momentum. So in fact, this had been going on in the background. And then basically because of the pandemic, things just lined up such that we were able to move through the regular processes. And so I know a lot of people are like, why is this available? The analogy I would give is, when you're going to a clinic now, once upon a time, if we had somebody who was elderly and we would say, can we do that clinical visit on the phone? Could we do this by video conferencing? And a lot of clinics would say, oh no, sorry, we just cannot. We don't have the resources. But all of a sudden, when the pandemic hit, boom, everybody was able to realign things to make that happen. It's not that those things didn't exist. It's just that now there was the will and the finances and everything to make it possible. The same thing with Zoom platforms. They existed before, but now have become very core to our everyday in a way that, I'm a mother, right? I have a 5-year-old and a 3-year-old. For meetings, people would make me come in person. All of a sudden now there's an alignment where we're able to do that. So it's very similar for the vaccine. There was an alignment, but it's still the regular processes that occur.
Okay, so you mentioned and you highlighted the 2 different vaccines, the Pfizer and the Moderna. And there is a bit of confusion, I guess, right now about whether you have to be consistent. So the question is it okay to take Pfizer for the first dose and Moderna for the second dose?
Right.
Should we be concerned?
It's better to kind of stick to the series that you have started. Part of it is that we don't know. So as much as I said we followed all the processes, it's still a new vaccine. So I know people are also asking, is it possible when you get the mRNA vaccines to also get like the Johnson & Johnson vaccine that will be coming out shortly, which is 1 shot. These are questions that we do not know the answer to, but we can only follow the studies as they were done. And so the studies, Pfizer protocol and then the Moderna protocol. So the recommendation is to just kind of stick to what we know at this point. But theoretically, there wouldn't be a problem. But the recommendations are kind of just to follow the protocols as they were tested.
Okay. And I think we recognize it in some environments, like your employment environment. Sometimes individuals may feel as though they don't have a choice because they're scheduled and then they have to go and have the test. So it's really helpful to know that they don't necessarily have to be concerned, but there is an ideal, is what I got from what you're saying. So one of the questions that the members have is about the impact of the vaccine on them if they have multiple comorbidities or any kind of underlying issues such as epilepsy, like asthma, chronic disease, cancer. Do they have to have any concerns about the impact of the vaccine on them?
So for the vaccine, you know, it's as I mentioned, the ones that we have available now are the mRNA vaccines. As far as we've
Mhm.
seen from the studies, it's usually the usual side effects that we would worry about, like pain or fever and that kind of thing. And then on occasion, for somebody who has severe allergies like anaphylaxis, again, just like any other vaccine, taking extra precautions. At this time, we don't have long-term studies. We don't have a crystal
Yeah.
ball, but as
Yeah.
far as we know, it's just as safe. But what I can base my recommendations on, and when I was deciding for my father who's in long-term care, because we had to make the decision for him, he has dementia, to have the vaccine, and in fact, I'm getting mine tomorrow because I'm going to be a vaccinator. But in that kind of decision tree for me, or making that decision, it's really based on what I know today. And so what we know is that COVID-19, if you have diabetes or heart condition or other conditions, if you get the COVID-19 infection, then your odds of recovery and full recovery are lower, and your chances of severe disease is much greater. And so we know that at least if you get COVID-19, the outcomes there's a risk that it would be worse. With the vaccine at this time, we don't have any indication that there would be any difference as far as one's outcome. You would then be protected, right? So there's a clear benefit there if you have other conditions.
Mhm.
But even if you're like myself, when the vaccine becomes, right now I'm going to be a vaccinator, but when the vaccine comes out, we, as a physician, particularly as a Black physician, I feel like my role is to say, I just want people to understand fact from fiction, and then you make your own decision. But at this time, the vaccine is our best defense against a virus that is disproportionately affecting our communities. And so when we, earlier Nicole talked about being able to gather in mental health. For us to gather again, for us to be in church again, in class again.
Mhm.
The other doctors laugh at me because I love carnival, right? Like whether it's to go to carnival, whatever it is, the vaccine is part of that, right? That doesn't keep people from, if there are preventive measures people want to take, we still have to wear our masks. If you want to take vitamin D, something like that, it doesn't keep you from taking other measures. But the
Right.
vaccine is a core piece of that. And so, yes, I will get the vaccine. My father has had his series in long-term care of the vaccine, and that's really the most that I can say. Again, I don't have a
Yeah.
crystal ball, but I know the devastation it has caused in our community, and I've seen the terrible impacts. So I know
Oh,
that, and I
yeah.
know the vaccine is our best defense.
So what you're also doing is you're modeling the way, right? You're leading by example, so which we appreciate that. You're not just saying, do as I say, you're also giving us the opportunity to do as you do, which is great. I have one more quick question for you before I go into your community question, and that is, should I get the vaccine if I already have had COVID-19?
Yes, so that's a common question, and the answer is yes. You should get the vaccine because, as far as we can tell, the immunity doesn't last we're not sure exactly when it peters out, but it doesn't last very long. So it is possible to get reinfected. So at this point, the recommendation is to get the vaccine, even if you've had
Okay.
COVID-19.
Okay, thank you. Okay, this question is from the Facebook poll. What is the risk in meeting with my friends and mixing households?
So I don't know if
It
people want a
sounds, it
number as
sounds,
far as a risk, but it's not really. I mean, for COVID-19, we know that it's best that we stick to our households as much as possible. The city is opening up, and so it's always a risk. There's a risk benefit ratio. We've tried previously with pods, and but with kids in school, all of the ideas of the pods kind of went out of the window. We still wear our masks and everything to go to grocery stores and things like that. So overall, it is really thinking about, okay, at a particular time, and depending on where you are in the city, because different parts of Ontario are opening up, it's really just being as careful as you can be. It would be my recommendation. I can't give you a specific number on a risk, but certainly we're following the recommendations from public health. And City of Toronto's situation is different than other regions, but we have a high rate of infection here. And so, yeah, you just really want to take your precautions and wear your mask and protect yourself as much as possible. But I hesitate to give advice at an individual level because I don't know your context. All I can say is it certainly is a risk. And so that's something that you have to kind of please keep in mind and follow the recommendations from public health.
Yeah, I think even just to elaborate on this question, as I was asking you the question, I can hear, Mayor Frank Scarpiti in the back of my mind saying, things like, please stay away from Markham and those type of vicinities. So I recognize that people are getting to the point where they really just need some people contact. They need some human contact, and their friends and families may be, maybe in another vicinity or another city or whatnot. And I think that's what they're asking. Is it okay for me to go and pay a visit? And what I'm hearing from your answer is not yet. Is that what you're saying?
Well, I'm saying it's best to kind of follow what the city of Toronto has recommended,
right.
And what our government officials have. So, like, as a blanket statement, I would say, like, the recommendations are not to, like, cross regions because of the rate of infection. In a rare situation, somebody needs, you know what I mean? I hesitate to kind of get into that. I think just follow the public health advice is the advice that I would give.
Yeah, and I mean, to Nicole's point earlier, there are guidance documents that provides us with that type of information. So I thank you very much for answering your questions. Don't go too far because the community members will be given the opportunity after the third speaker responds to ask general questions. So Nicole, you're up. And we are going to be focusing on testing, statuses of cases, epidemiology, and what type of supports are available. So that's what we're going to focus on with your questions. So first question, what is important for our community? No, sorry. Why is it important for our community to get tested for COVID-19? And is a test safe?
Thank you for that question. Excellent question. So we've mentioned before, I think all of us have spoken to the differential impact that we're seeing in our communities. And as we know, oftentimes members of our community are the frontline workers going to, long-term care, providing care for our elderly there, working as nurses, working in grocery stores, in a variety of different areas where we're not given the luxury of staying at home and able to protect ourselves. We know there's a variety of systemic reasons where people, in a society where we do experience significant levels of racism, that opportunities are not afforded to us all equally. So it's really important that we keep our essential workers and our communities as safe as possible. An important strategy to help keep our community safe is testing. And to know for those that are infected with COVID-19 is to isolate themselves to protect their family members as well. They may be living in multi-generational homes, and you want to know if your mild symptoms are a runny nose, coughing, etc., is COVID, best to get tested and isolate. We do understand that in some communities, this may mean that the sole person in the home that is making money and supporting the family is unable to do so. So we do work with ensuring that individuals that go for testing are aware of the resources that are available to them. So the community health centers across Toronto, there have been 5 that have been identified in high priority communities: Black Creek, Rexdale, TAIBU, Scarborough for healthy communities, and Thorncliffe Park, CHC, where they can get linked to case managers, and there's community outreach workers that will link them to financial support if it's applying through to the federal programs, providing or applying to the city programs to provide income support, as well as if they need to isolate at the Toronto Voluntary Isolation Center. So if they're in a household where they're unable to safely isolate, this is something that's available to them as well. And when we do our case investigations at Toronto Public Health, we will try to identify families or members that could benefit from that. So either the close contacts or those that have COVID themselves. So there are a lot of resources out there, and I know we all want to keep our families safe. So testing is an important part of that, as well as staying home when you're feeling sick. You asked the question if testing is safe. Yes, there are many different modalities of testing that's been used by our COVID assessment centers across the city of Toronto, and it is a safe process. So there is the NP swab that goes a little bit deeper. There's one where you just do the nose and the cheeks, and we also use in the school environment for staff and students when we're doing some coordinated testing for schools. There is a saliva test. So it's actually spitting into a sample cup, and that is then taken to the lab. So we try to offer a variety of modalities, and the government and the provincial government continues to look at faster ways to do testing, which is less invasive, and try to make it as available as possible. The city has worked on having mobile testing available in the community, and we do look at the data. So areas where we see COVID activity rising and not enough testing happening, we try to get the testing right to those community and work with our partners at Ontario Health, the CHCs, and other community agencies. I will say it's been an amazing experience getting to work very closely with these broader community teams, and I do feel like we're part of one big team. And so we do encourage people to get testing and to know that there are supports available, so that if you do test positive, that you can isolate safely, have some income replacement, etc. So we do encourage you to go for the testing.
That's very important information. And I'm going to dig a little bit deeper in one of your other questions. Could you discuss the COVID-19 neighborhood cases and the rates among various communities? So why is the Black community disproportionately impacted by COVID-19?
So I think I started to allude to that. And I think, people wonder, and I will say, I'm going to talk about my dad, who oftentimes, he's retired and he listens to the news. He's, over 70 and in the home and paying attention to the news quite a bit. And it's concern. It sounds like we're blaming the community. We're blaming Black people or racialized individuals for the spread of COVID. Is it behaviors? We're gathering, we're not listening, we're not staying home. And that's absolutely not the truth. I think we have to acknowledge that we are in an environment and a system where systemic racism does exist. And truly, if people have lower income, their jobs that they are doing are at because they don't get those opportunities due to racism and historical and systemic issues that doesn't allow those same opportunities for all, even all things being equal, you apply for a job. Some people get it and others do not. And it's oftentimes because you identify as being Black or Indigenous or other racialized population. So we then find ourselves in a situation where there's an overrepresentation of people from our community that are living at a lower income, doing those essential work where they don't have the luxury to isolate at home. They're not the CEO of, whichever big company you want to mention. And they just don't get that opportunity. So it becomes much harder. And I think it is a responsibility of broader society for those that have the opportunity and the privilege to stay at home, to do so, to keep those that cannot safe. So when they're taking the TTC, and we hear in some of the neighborhoods on the Northwest corridor that some of those TTC routes were quite overcrowded. And we worked very closely as the city and Toronto Public Health with TTC to get more buses and services there to reduce the crowding, because people need to get to their job to feed their families and support their families. So in the long run, and I thought about this quite a bit, in any pandemic, we're going to see the people that are at the lower end of the socioeconomic status impacted at a greater extent. We saw this in the Spanish flu when you read historically about it. What you want to see is it's not targeted to specific groups. So if people at that lower income, truly in a society that wasn't based on systemic racism still and colonization, you wouldn't see that it's the racialized individual. So we know Black people are overrepresented, Southeast Asian groups, Latin, etc., with the COVID cases. So important part of fixing this issue, and I hope the legacy and the good that will come out of all the work and the equity work related to COVID is that we reduce the barriers, we increase opportunities for many people so that we're not in the continual situation. We need to put into those areas, the Northwest, Northeast part of the cities that have, they've stated very loudly, and advocates and activists, we need more in these areas. We need investments from government to build these areas up and give people equal opportunities. So, breaking down those barriers and dealing with systemic racism and acknowledging that that's what we're seeing and this is why we're in this situation is very, very important for us to get out on the other end of this and to give people hope for a better way.
Oh, absolutely. So thank you for that. And Nicole, you mentioned a little bit about financial supports and isolation centers. Tell us a little bit more about what types of supports does the Toronto Public Health offer for Toronto residents during the pandemic, and speak a little bit about like self-isolation supports and PPE supports and those type of things.
So thank you for that. So we work, it's beyond just Toronto Public Health. We work very closely with other divisions of the city and our community agencies who are on the ground are helping support a lot of this work in the community. So there is a program called TO Supports that has provided funding to a variety of different community agencies to be on the ground and working with individuals. And so this is an important aspect of the work that we're doing. So Toronto Public Health, our focus really is on case and contact management, contacting the close contacts, et cetera, in order to reduce the spread. And we've been doing a lot of that work and reporting on the data, getting the social demographic data out so that people know what the pandemic and the impact it is having on the population. So some of the financial supports that are available is linking them to whatever's available through the provincial levels and the federal levels. And we are seeing this through our community health center partners who are very instrumental in providing some of that work. So the province did release a high priority community strategy where they provided additional fundings to this community health centers in the city that we supported and advised the government on moving this forward. And that is where we do quite a bit of our work. So we can't do this all on ourselves, and it is really the big team working together to support community. We do the Toronto Voluntary Isolation Center is something that is run by Toronto Public Health, and referrals can be made to the center. And this is an opportunity for people to safely isolate and receive meals as well, and ensure that they're in a safe environment and getting the supports that they need while they're isolating there. So there are lots of resources available. And as you mentioned before, we have our guidance on the city website, and it has a lot of links to a variety of these different supports that are available. And I encourage you to reach out to your community health centers such as TAIBU, who has a hotline as well that can help support people to get them the information they want. And for those that are hesitant to go for testing for fear that they are COVID positive, and that means that they're isolating for a period of time, and family members and close contacts as well, reach out to the hotline, ask questions, what is available for you, so and you can begin to prepare yourself for if you do get that testing result that indicates you're positive, that you have those things in place, and to prepare your family members and so forth, so that you can be supported through that period of time.
So you shared with us, the importance of case and contact management. And I think it's great that we're doing that and hopefully doing that well. What is contact tracing? How important is it? And how can the community participate?
Yes. So contact tracing is when you identify a case or someone that is test positive for COVID-19. It's talking to that individual and reaching out contacting them so that they can give information on who they have been in close contact with. I won't get through, there is some criteria and so forth. So I won't go into that level of detail, but we do also ask individuals to contact people that they think they have been in close contact with, to advise them, encourage them to go get testing as well. So it is a communal effort, and public health units can only support as best as what people tell us. So people need to be open or telling us where they've been, if they've been in any gatherings, for instance, even though they're not supposed to be. Like we need to know this information so that we can help keep everyone safe. Another important tool that is out there is the COVID app. And we do encourage people to download the COVID app and use this, because it will provide an alert to you if you have come into someone who close contact with someone who has tested positive. And so because it doesn't do that full assessment, what it says to you is to go get testing to determine if you are positive or not. And if you're not, then you're free to go back to regular life, so to say. And so it is really important that we work together as a community to support one another. We often work with workplaces in high risk communities, and when our case counts were extremely high, and we're still seeing counts around 300 or so, but much better than what we saw even up in December. Our numbers were quite high in the beginning part of January. So we have seen a steady decline, which is fantastic, and we know the public health measures has really helped to contribute to that. When case counts are really high, it's very difficult for a public health unit to do it on its own, of contacting all the contacts, because you can just imagine one case can generate hundreds of contacts, quite frankly. So we do work with our high risk settings, congregate settings, shelters, long-term care, schools, and I'm missing a few there, but as our high risk settings, and where we work with the individuals that run the shelters or the school or the workplace to help identify the contacts in those environments so we can get the information out. In the school setting, we would send out letters to the principal and the families to say, hey, you were part of that cohort, you've been identified as a high risk contact, please stay home for this period of time. As our investigation gives more information, we do more testing in that environment. We would update the families and students with that information. I talk about schools because I live it every day. So, but we do that in our other high risk environments as well. So it's very important that we work together as a community to identify those close contacts as well, and isolate people as soon and as quickly as we can to prevent further spread of the virus, and to keep those public health measures in place. So the three, washing your hands, watching your distance, and wearing your mask. We see that those things have been quite effective, and reduces the cases. So this is also very important stuff. As far as PPE, a lot of the workplace and organizations, they distribute that to individuals. The city has distributed cloth masks at different points in time, and those are important things to continue to advocate for, and ensuring that people have access to that throughout our communities.
Wonderful, thank you. Your question from the Facebook poll, I think that Dr. Nnorom will really appreciate this question as well. So it's a gift for you. See, you're getting gifts as panelists anyway. And the community members want to know, how do you register to get a vaccine? Sorry, it's your question actually, Nicole, but I'm
okay.
Dr. Nnorom would appreciate the question.
Oh, okay. I didn't know if it was for Dr. O.
No, sorry, it was your question, but I was sharing your gift with her.
Yes. So more information on registering for vaccines are to come in the weeks coming up. As the different priority groups have been identified by the government, information has gone out, and we're waiting for vaccine supplies to come in, and we will continue to share that information and working with the community to ensure that all those that are eligible when their turn comes up in the priority sequencing can have access to that. So we're in the process now of gathering more information about different different high-risk workplaces, healthcare workers, and by age group as well. So I know families have been asking if they have an elderly person at home, how can they register? So we are taking in that into consideration because a lot of it's done online. Sometimes, you know, some people don't have it online. So we are going to be working with all our partners in the community, our community care teams, our Ontario health teams, Toronto Community Housing, shelter supported housing, and through businesses as well. We do have a connect at the city level to a variety of businesses to get that information out there to ensure that people know how to access the vaccine when their time is there. So we will definitely be doing broad scale promotion and providing that information. Toronto Public Health is in the process now of gearing up to open up 9 mass immunization centers across the city in different regions, and that information was released, I believe, last week. So and it would be on our website as well, and so that there's opportunity for community to register and have access to the vaccine within the community, and we will go through the prioritization. So more information to come on registering, but we're taking it everything into consideration and really talking with the community and connecting. We do have a community outreach and engagement arm of our immunization task force that's making that connect with community to ensure that everybody has access and similar information and ability to receive the vaccine when their time comes up.
You know, I would say that it's comforting to hear, and I feel as though I heard this from you, is that the high priority community strategy that was put together is being actioned, and it sounds like for the most part it's effective. You know, I'm not saying that it's the answer. It's not the be all and end all, obviously, but it's really nice to hear that is working so far for us. So thank you very much for answering the questions. And Madame Mitzie, you are up next. So your section, Mitzie, is going to cover government supports to community members and policy affecting community, which I'm sure you'll answer very well as well. So what impact has COVID-19 had on you and your family, immediate or extended?
Well, thank you. Thanks, Cheryl. You know, spoken like a true nurse. First question is about my health and the health of my family. And I truly appreciate that. And I want to, you know, I actually, one of my aunts is a nurse at the Scarborough General Hospital. So I understand that care and that compassion. You know, for my family, the isolation has been the most difficult. It's just really hard. We're a family, a big family that would normally gather together for holidays or just any day, you know, just on the weekends, just to be together, and not being able to do that. I haven't seen my eldest brother in over a year. The last time we gathered was for the Christmas holidays last year, and my niece, you know, she went off for her first year of university, and you know, she's doing it remotely from home. Very different experience, certainly, than my first year at university, when I got to just really grow in that immersive environment that happens on campus. And that mental health and that physical health is very wearing on members of our family, particularly those that are older. So my parents, you know, my mom and my stepdad, they pay very close attention to that and really try to get in some form of fresh air and exercise, even though it's winter time now. We came up with a plan for them to stay active, whether in the house or getting outside for short walks and things like that, as long as it's safe to do so, in terms of the actual environment itself. But there's also some joy that we've had. My youngest brother him and his wife had their first child, and he arrived in December. And every day I get to see him, either a photo or we do, sort of some sort of face-to-face over technology. And like he's a joy and the light of all of our lives. And this one tiny little baby, 2.5 months old, but he's a real gift. So that's some of the things we've been doing, and just trying to really support each other as we make it through, and really longing to spend time together as a family again physically. I'm dying to hold my nephew. I haven't
I'm sure you
had
are.
a chance to do that. He did actually do a drive-by visit. I've had a couple of those, and
So you know what, Mitzie, I can feel the joy, but that's a good segue. That drive-by visit to see the baby is a really good segue into the next question. So as a Black woman, how have you and your family been practicing and promoting COVID-19 related safety during the pandemic? So it takes me back to the other question that came from the community members about, can I go visit my family? And it almost sounds as though, have you not heard? No, stay home, don't go. But you're just talking about the real side of it. And we saw the emotion in your face as you're talking about this new life that has come. They have a term now, they call them pandemic babies. I don't like that. It doesn't sound positive. But what are some of the practices that you can sort of share with everyone around that?
Yeah, and baby Jordan, his name is Jordan Hunter. Jordan Oliver Isaac Hunter, and he is a hope, because we all have to recognize that the pandemic has struck, and it's taken away a year of our lives that where we had all these plans, and we've had to put those plans on hold, and it's changed everything. So in my family, we practice really closely what is being recommended by public health and by the government federally and provincially to keep ourselves safe. Wearing masks. My parents wear masks. So even during non-lockdown times, if I had gone over to see my parents dropping off groceries, or just checking in on them, we would wear a mask and we would distance. Even if we were going to share a meal, my parents would be at one end and I would be at the other. We stuck to whatever the limits were, in terms of your bubble. So we stuck really closely to that, because it was the only information we had around how to stop spreading the virus and how to keep the virus out of the home for our elderly parents. We were very, very concerned about that. And thankfully, my most immediate family has been protected from the virus and has been safe from the virus. We don't have any known cases, but it has not been the case for friends and others that I know in the community, where the virus has taken its toll on families. Just a very dear friend, elderly parent, but doing okay, living a long life. And unfortunately, the virus came in through caregiver support, and he passed away. Devastating effect on that family. So being not tired or exhausted of doing those things like hand washing, I know it's tedious, and my fingers are being stripped from doing it, whether it's with hand sanitizer or washing with soap and water. But I do know that from listening to public health, like that is the way to not take the virus from outside environments into your home environment. Sanitizing your home environment, changing your outside clothes, like just things like that might seem very tedious. not getting weary of doing that, even at this late stage of the pandemic, so that you are protected and that your family and your loved ones are protected.
Mm. You know, there's a lot of misinformation out there. So I think it's very important that we share, you know, some of the stories that you just shared, even around people passing away. And we know just by the story that you shared that it was preventable. And sometimes, you know, if it isn't close enough to the individuals, it doesn't necessarily resonate with them. And with that said, some of the misinformation is coming from anti-vaccine, you know, platforms. Social media is a wonderful thing, but it can also work against us when we're trying to get evidence-based information out there. Particularly in our community, there's all types of information being shared around, you know, the vaccine and negativity and stuff like that. What is your message to address the hesitancy or mistrust that the Black community has towards the vaccine?
Yeah, and I care very much for the Black community and for the community at large. And I understand the hesitancy. I understand that it is rooted in very real historical contexts that have damaged the relationship of trust that the Black community has with the medical community and with the public health community. I understand that. At the same time, we have to use wisdom for today, understanding that the vaccine has been developed with tremendous amount of careful protocols, and you know, the efficacy of what it is designed to do, it does very, very well to a high degree. We've all been vaccinated at some point, most of us. So we are used to taking those vaccines, whether as a child or as an adult. You know, if you look at the measles vaccine, you know, 95% of the population has to have it in order for us to even maintain safety in our population. And so vaccines are not a new phenomenon, although the way that these ones have been developed, they've used new and latest technology, but that's what's protecting us now, is that new technology. They are free, they are safe, and they save lives. Think of that elderly person who is so vulnerable to catching this virus. Think back to the people that you love. Think back to your own ability to work and to have recreation and freedom. And the vaccine will provide that for you. As a community, we have to think about access and equity. And by that, you know, we were talking about, how do you even know when it is your turn? And if I can take a little bit of my time to really go over when it is your turn, and what to expect around being notified, what is our phasing. So right now we are still in the first phase of the vaccine. And by that, I mean making sure that all the long-term care residents have received they've all received their first dose, but some are still getting their second dose. High risk retirement homes and our First Nations elderly care communities are now being vaccinated. There's also those who are working in close contact with those individuals, those healthcare workers, like Dr. O said, she's, receiving hers because she's going to be a vaccinator. I was so thrilled to hear that. So the staff who are providing essential care, they will be getting that. And then there are patient type individuals who, for whatever reason, will receive it. Those in congregate care settings will receive it. The next priority, which is the one that we're about to enter into, when those doses that the federal government has secured, I believe 600,000 plus dosage will be, if they haven't already arrived in Canada, will arrive this week. So, the dosage by the end of this week will be here and needing to be distributed. So adults 80 years and over will be part of this next phase. Continuing to do staff and residents and caregivers in retirement homes and in congregate care settings, assisted living facilities, those types of places, healthcare workers, and my understanding is that even teachers will be part of this next phase, more Indigenous adults and adults who receive chronic home care. So through your CCAC or in some way you're being cared for at home, then through those mechanisms, those adults, regardless of age, will be able to access the vaccine. Then, and how will it be rolled out? I think that's also a really important thing. So I have to say that Nicole Welch, who's their chief nurse here from Toronto Public Health, you are really the most important person on this call as it relates to vaccines, because the province just this week has announced that the 34 public health units will be the delivery mechanism in every region for the vaccine administration in the phase 2 and beyond. And so that is going to become an increasingly important role, because as you will see, the vaccines will flood our system and they need to get out as quickly as possible. And those public health units with their local knowledge will have the responsibility of doing that. In addition to that, hospitals, on-site clinics, and there are a variety of them. Nicole mentioned the large vaccination centers. So the Scarborough Town Center has been designated as one of those large centers in Scarborough, as well as I believe there will be a site in Malvern for Scarborough. And then there will be mobile testing vaccination units to go to those congregate care settings, so where people live in close proximity, and continuing our Indigenous vaccination for urban communities. In terms of the next phase.
Well, one second, Mitzie, before you jump to the next phase, one of the questions that came from the community is about the rollout, and you just mentioned that. So they're asking, why is the rollout in Ontario so slow compared to other developed countries? So yeah, go ahead.
I think the main issue, certainly when you think of December and January and the first part of February, was the flow of vaccines, the understanding of what are the correct protocols from the vaccine manufacturers. Some of that did slow down the efforts, but at the same time, we knew it would be a slow start. What we're going to get to now in terms of the mass delivery of those vaccines, which is pretty much going to start in April to July, we really need to vaccinate 8.7 million people in our province in those short months. And so, we're going to start to see, information about your turn, where to go, or you proactively find yourself at one of those mass vaccination centers to get vaccinated. And that's what we're going to have to do. All of us are going to have to line up and, roll up our sleeves literally to stop this virus in its tracks. And the only way that we will stop this virus is if all of us will get this vaccine. And so we're gonna see that happen, certainly on a mass level starting in April. So what I described to you in terms of the phased approach were those very vulnerable pockets, because we know that they are most at risk of getting ill and some even dying from the virus. So we have to get to those vulnerable pockets first. The most elderly, the most at risk in terms of what they do, in terms of their occupations.
Wonderful. So I have a ton of questions. You guys have intrigued the community members. But before, and when I ask the questions of the community members, I'm going to throw it out to the entire panel. But before I do that, Mitzie, you talked about the priorities and the phased approach. Is there anything that you want to add in terms of the long-term strategies that we should be considering to address the impact of COVID-19, particularly in the Black community?
I do. Because as some of our panelists have said, the vaccine has had a disproportionate effect on the Black community based on perhaps occupation and really going out to work. The first personal support worker that succumbed to the virus, was a woman of color. And so what I want to see is that we learn from this pandemic, that we continue to collect race-based, disaggregated data that includes even those taking the vaccines and across all areas of our society, because this information can help us to inform where the resources are most needed. I was very thrilled to see the high priority area being funded. It was something that I called on the provincial government to do, and I would call it COVID hotspots. That's what I would say when asking about it. I'm like, the COVID hotspots need more resources, and finally we now have that money and those resources flowing. So the only way we were able to make that case was by the data. There's also something happening which is called a K recovery, and there was a risk of a K recovery where certain members of our population that was not too impacted economically. They worked from home. They continued to collect the regular paycheck and were doing it safely at home. So they will recover pretty fast once they're vaccinated and once things get back to a routine. But there are others who are lagging in the recovery. Women are actually quite high in that group. And I think if we dug deeper, we would see that it's racialized women and youth as well. And perhaps if we dug deeper, we would see a disproportionate number of racialized youth. Equity-seeking groups are hardest hit. So the recovery needs to be not just broadly targeted, but specifically targeted to assist those groups in getting back into the economy and into a path for their future. Building back better is not just a phrase. I don't want to go back to the way things were before COVID as it relates to anti-Black racism or systemic racism. I want our community to come out of this stronger and better, and where we put some of those things behind us. And so there's a lot of work that needs to happen in order for us to do that. And I'm looking forward to doing that work. There are other aspects, education. There is an education gap that we have to make sure we assess them along the lines of the impacts of the Black community, because as we know, a lot of children and students were not receiving the same education as they would normally receive. And of course, seniors, making sure that they have been the hardest hit in this pandemic, even just their mental health and their well-being. And we make sure that we wrap them in love and courage coming out of the pandemic.
Nice finish. Thank you very much, Mitzie. Okay, I have a series of questions from the community. And I think what we will do is, because I've kind of eyeballed the majority of the questions, and in looking at them, quite frankly, any one of you could answer them. So if you can just raise your hand and then unmute yourself, then you can go ahead. All right, let me see here. When will the vaccine be available to seniors in the general public? And when will the vaccines be available at their family doctor?
Okay, so I don't know, Nicole, did you want to take a stab at it, or I can provide the sort of the phased response that I was going through?
Yeah, Mitzie, you can go ahead with the phased response. I would provide the same information.
Exactly. And I think that right now, we're going to be getting hundreds of thousands of doses of the vaccine. So the supply in the month of, let's say we finished with February, as beautiful as Black History Month has been, and we're now into March, you're going to start to see supply. That's no longer going to be an issue. So the elderly will be the first priority for that, and so there will be multiple ways of accessing that vaccine. Through hospitals, through clinics, through mobile sites, and through the networks, community health centers. We mentioned, of course, there's TAIBU, but there's the Community Health, Scarborough Community Center for Healthy Communities. All of these places will be able to do that, even at pharmacies and other health-related health settings will be equipped with that. We also need to remember that we're also very close to approving other vaccines, which are going to change how available the vaccines will be. So keep your ears tuned for information on where you can get the vaccine in your area and in your community, because I believe that for the elderly, the month of March will be the time that they will be notified that they should come and get the vaccine, or people will be deployed to their location if they're not able to leave their home.
Okay, so this question, quite a number of people also had this particular question or some variation of this question. Some community members are interested in getting tested. However, they believe they may be exposed to someone with COVID-19 at the testing clinic. So how can we assure that testing clinics are safe for community members that are not exhibiting symptoms? Go ahead, Nicole.
Thanks. So the testing centers, so they're run oftentimes by the hospital or community health centers, and Ontario Health aid, the different, what were called LINs prior, or local health integration network. So they have a lot of experience, and there's physician that has to be associated with the testing center to write the orders, and they ensure that public health measures are in place. So some of the centers will be open to drop-in times. Others are by appointment only. But what they do is ensure that they have appropriate staffing and security to have people keep a distance, wear a mask. We ask that everybody wear a mask before they come to do their testing, and that the appropriate measures or infection prevention and control measures are in place at the particular testing site. So the cleaning of the area, the appropriate disposal, etc., are all in place. And there's a lot of care and strict adherence to these measures to ensure that we do not get gatherings, large size of gatherings, etc. And this is something that the COVID assessment centers have worked very well at. You may have remembered sometime in the fall, there was a rush for a lot of testing, and there was a lot of people coming to the centers, and public health worked very closely with the testing centers to ensure that, the measuring, the tapes were there, have people distance, wearing masks, having the signage available, and setting up the appointment system as well was something that helped with it. So a lot of care. It's a safe place to go. And it's important as individuals, when you go to these places, that you ensure that you're keeping your distance, wearing your mask, and cleaning your hands. So if you do have to touch a door, ensure you use the hand sanitizer, etc.
And the individuals at the testing center are doing the same.
Yes, you got it.
So can I just say, just really quickly, obviously Nicole is public health and she knows exactly how this is all running, but I went to visit one just to make sure that I was comfortable with how it was serving my community, and it was a pop-up one, and there are all the protocols there. There is security on site. You do need to sanitize your hands. You wear a mask. And I went to a local hospital yesterday, and the protocol has even changed. So no longer do I have to remove my mask. I put the medical mask on top of my mask. Yeah. And I just noticed that it's a slight change, but it was less contact to do that. And so to prevent and stop the spread, following these public health standards is really what is keeping us all safe. And we've been doing this now for almost a year, and we have not seen these sites as a place of outbreaks. These sites are safely managed places, and you can go and get a test and feel confident. What I worry about is that in Scarborough, in particular in my community and around Scarborough, I see that the infections rates are higher because whole families are getting infected. And so, you know, that means that someone had a symptom and didn't necessarily get the test to isolate and to do all the extra precautions. And then that virus spread to other members of the family. So
Absolutely.
really important to get tested if you suspect you've been exposed or if you have any of the symptoms.
Thank you for adding to that, Mitzie. Okay, so this question I welcome. Okay, that question went away. Okay, so this question is from YouTube. It has been said that low vitamin D levels contribute to more serious outcomes from COVID-19, and that people of African descent are more likely to have low levels. Why is testing not done annually?
So I think that one's for me. I didn't raise my hand, but I presume that one's
All yours, Dr. O, all yours.
So, so vitamin D is a bit of a bit of a complex piece, but I'll kind of address this simply by saying, like, vitamin D, it is good for us to take vitamin D supplements. So people with darker skin tend to have lower levels of vitamin D because, so the plus side is that we have a natural sunscreen. We still need sunscreen on top of it, but we have a certain level of a natural sunscreen, but that also blocks us from being able to absorb sunlight and turn it into vitamin D compared to people who are lighter skin. So there's a pro and a con, right? So, so with that, we tend to have lower levels. In Canada, almost everybody has low levels of vitamin D, particularly in the winter time. So that's why we don't go around screening people for vitamin D deficiency anymore. We just say, okay, you can take vitamin D. You know, for somebody who's very light skin or a white person, I would usually say about 1,000 international units, or even, you know, 400. For a darker skinned Black person like myself. So it depends. It's not just the race Black, but how dark your skin is and how much natural sunscreen you have that's blocking out the vitamin D conversion, then, you know, even up to 3,000 international units can be safe. It's very hard to overdose on vitamin D. So overall, we're kind of told as physicians to just recommend vitamin D, but we don't test as much for it. It is a vitamin that is responsible for a lot of different things, but not any one thing on its own. So one area is bone density. So it certainly helps our bones to be stronger, but also plays a role in infection and our immune system. So there have been studies looking at COVID-19 and vitamin D deficiency, but it's not clear when you would have to take the vitamin D to have that kind of protection. Like maybe the people who are most protected have been taking vitamin D for like 10 years, how much and to what extent it protects. So, you know, even, you know, Dr. Anthony Fauci, he's like, okay, well, I'm just taking vitamin D. So I would say, yeah, there's so many benefits for it. It makes sense to take it, but it's not at the point that we would either test it or say to people, you need this much vitamin D to protect against COVID-19. I would say it's almost the same thing as, you know, you need to get enough sleep. If you haven't slept and you haven't rested or whatever, that can affect your immune system as well. So you want to be rested, you want to have vitamin D, you want to, you know, take care of yourself, but it cannot compare to the impact of the vaccine as far as protecting us. So, so it can be part of your, you know, wear the mask, take vitamin D, all of that. That's beautiful. But the vaccine is where we have the most protection based on the evidence that we have right now.
Wonderful, thank you. I think that, Nicole, you'll probably love this question. This is from Facebook, how can I contribute as a vaccinator RN?
I love that question because I actually live outside of Toronto, and I've myself gone online to see if the public health unit in my area is hiring part-time vaccinators, because I want to, like Dr. O, get my hands right in there and being an administrator, I'm not hands-on. So my kids will finally say I'm a real nurse, right? And
Mhm.
so there are job postings. It depends on where you live in Ontario, but I would recommend that you look at your different public health units to see if they are posting for vaccinators. I know we did have a job call. Sorry, I don't know if it's up right at this present time, but we do update, and we're looking for individuals to do this work for sure. And I know even some retired nurses have gone through
Oh, yeah.
at the College of Nurses of Ontario to get their license reinstated so that they can
Oh, yeah.
also to become vaccinators. So please check it out, whichever region you live in. And if you do, there's part-time opportunities, full-time opportunities, and we can all roll up our sleeves and get right involved. Maybe we'll be in a clinic with Dr.
Yeah.
O. And
Yeah, and if I can add to that, the College of Nurses, yes, they've expedited the licensing, and also the Registered Nurses Association of Ontario, RNAO, they have a portal in which individual nurses that are available for many things can put their name forward. So I think that
yeah,
that's also, and they
and
don't,
that's
sorry, somebody was,
sorry, no, I was just going to say, Cheryl, that's very important. There are our Registered Nurses Association of Ontario.
yeah,
We have gone there and worked very closely with them when we were looking to increase the amount of individuals that can do case and contact tracing. So it's been
that's
an
right.
excellent resource.
Mm-hmm.
And
So I'm
Liban is saying, come to TAIBU. So
oh, absolutely.
make sure your community health center is also on your list.
Oh yes, for sure,
Absolutely.
for
Most
sure.
definitely. I was thinking the same. This is probably for you, Mitzie. The community members want to know what other government supports are available to our community specifically.
Well, I want to say that there's a lot of supports available to the whole community, but our community is not participating in those supports at as much as you should be.
Mm-hmm.
For instance, there was support through those who pay their hydro bill directly to an electric company.
Yeah.
So Toronto Hydro, or if you receive a bill directly.
Mm-hmm.
There are programs that was set up by the province if you saw your hydro bill increase as a result of the pandemic, where you can get a break on that. And that program it wasn't overrun. In fact, they were asking for people to apply to the program. So really listen out for any of these supports and services that can help you and your family, and participate in that. For small business owners, and there are a number of small business owners in our community, there is a small business support grant of up to $10,000 or $20,000, depending on your loss of sales, from April of 2020 till now. And you just need to go on the portal at the Ontario government and fill out the information. Talk to your accountant as well. And if you do tax filing, that's the season we are in right now. I really encourage every single person on the call and telling your 5 friends. I know that's how we started this meeting. Tell your 5 friends and family members to do their taxes, because a lot of the transfers that governments make to individuals are done through your taxes, and you don't want to avoid doing your taxes or delay doing your taxes and miss out on those opportunities. And that goes for individuals and businesses. I know a lot of businesses were hurt because they weren't keeping up with their filings and they weren't able to show records. Well, you can get the support of financial professionals in your community and be able to access those resources that are available as well. For nonprofits, there are a number of grants available in the community also, and you might want to just explore if any of those can benefit you at this time and at this stage as well.
Thank you. And I thank all 4 of you very much for responding to my questions. And now I will hand over the mic to Mr. Liban Gaba-Mekiel to provide you with some closing remarks.
Thank you very much. First of all, to the panel, this was great. I mean, even for me to have some learning and some information, new information. But most importantly, really thank you, because you spoke not just as a professional or somebody who does this, but from the passion of what you do on a day-to-day basis. And thank you for continuing to support the work that we do here at TAIBU. Mitzie, of course, always a pleasure. Nicole, definitely, the work that we've done over the past years with public health. And Dr. O, I never knew you had a Dr. O calling. So Onye, thank you very much. Obviously, you're a TAIBU family. You've been at TAIBU. You are at TAIBU all the time. So, but for me, it is really, the passion that you showed with what you shared with us and with the community today really speaks to, number one, this is a serious issue and we need to address it in that way. Two, we have opportunities to bring about change. And there are things that we need to protect ourselves. There are things that we need to do. There are things that we need to do for the community as well. So this is great. Thank you very much, as always. Of course, my boss, Cheryl, for moderation. As always, it's always a great pleasure to work with you. And thank you for the reflections as well that you brought. I would also like to take this opportunity to say thank you to Renee Wilkinson Owusu, who has really worked very hard to coordinate this with her team. And I know Annie is with us today, but there is a COVID-19 team behind this, and Kiana is also there. So, but we have, Kiana, we have Ahmed, we have, who am I missing again? Renee, we have quite a few people anyway behind the scenes that have really worked very hard to not only on a daily basis to address COVID-19 out there, but also to organize this town hall for our conversation, our learning and engagement with the community. Yes, if I heard there was a nurse who was interested how they can be involved with vaccination. TAIBU is going to be starting our vaccine. We have started our testing, and we've also said that we want to be a site for vaccination so that communities have choices and can access space that they know comfortable with, right? So the indigenous, the francophone, the Black communities. So TAIBU is going to be doing that. And yes, I think the testing question around, is it safe? I think the testing space is the most safest space because of the strict regulations and infection control process that you have to take to. So I'm sure all testing centers do that, and it's about protecting people, but also protecting staff. So that is also something very important. Lastly, I think, let me just make sure Renee, Kiona, Ini, Annette, and all other, of course. Okay, thank you. So now there is one more item that I get the pleasure of introducing, right? When you are in my position, you get everybody to do the work and they just appear to say, here is what I'm doing all day, right? But anyway, we have a promotion for the COVID-19 support that we provide to the community, including the testing and the vaccination. And we would like to kind of launch that promotion video here at the town hall so that community members can spread the word, right? Spread to 5 other people is what we have been told to do. And Mitzie reminded us earlier on. So I will let the technical people launch the COVID-19 support video. Thank you. Help.